Your blood pressure monitor just flashed 180 over 100. Your heart is hammering. Your vision feels slightly off. And somewhere in the back of your mind, a terrifying question is forming. Is this the moment everything goes wrong? What happens in the next 5 minutes could determine whether you walk away from this or not. And the most dangerous part, almost everything your instincts are telling you to do right now is exactly wrong. I've spent 20 years as a physician watching people make the same critical mistakes in moments like this, and today I'm going to tell you what nobody else has bothered to explain clearly enough. Because the difference between a temporary scare and an irreversible tragedy often comes down to a few specific decisions made in the first few minutes. Let's start with the truth that most doctors don't have time to sit down and explain during a 10-minute appointment. When your blood pressure hits 180 over 100, your arteries are not just a little stressed. They are operating at the very edge of their physical limits. Physicians refer to this range as the zone of imminent danger, and that name exists for a very real reason. The walls of your blood vessels, especially the delicate ones inside your brain, are under enormous mechanical pressure. Think about a garden hose connected to a pump running at full blast. At some point, the hose doesn't just leak, it bursts. And when a blood vessel bursts inside your brain, the damage that follows can be catastrophic, permanent, and completely silent in the moments just before it happens. This is the silent killer, and it earns that name every single day. What makes this so terrifying is that there are often no dramatic warning signs, no chest-clutching moment like in the movies. Some people feel a heavy throbbing at the back of their head. Others notice blurred vision or a strange mental fog, like thinking through wet cotton. Some feel nothing at all until the moment a vessel gives way. Within minutes of an uncontrolled pressure spike like this, a blood vessel in your brain can rupture and cause a hemorrhagic stroke that leaves you paralyzed, speech impaired, or with memories erased as if someone wiped a hard drive clean. And yet, the two most natural reactions people have in this moment, lying down to rest or rushing frantically to their car, are precisely the two things most likely to accelerate the disaster. So let's fix that right now. The very first thing you need to do, and this is more important than anything else I'll say today, is get yourself into what's known in clinical medicine as the vascular safety position. Your body is going to scream at you to lie flat in bed. It's going to tell you that rest means horizontal. Ignore that voice completely. When you lie flat during a blood pressure crisis, you eliminate the natural downward pull of gravity that normally keeps blood pooled in the lower half of your body. Without that gravitational anchor, blood surges freely upward toward your head, dramatically increasing the pressure inside your skull at the exact moment when your brain vessels are already at their breaking point. You would essentially be removing the one natural force that was helping protect you. Instead, you need to sit down immediately. Find a chair, a couch, or anything with a solid backrest. Position your torso at somewhere between 45 and 90 degrees. Think of how you'd sit in a recliner that's only partially tilted back. This angle is not accidental. It is the same position paramedics use when transporting patients with cardiac or respiratory crises. They never lay these patients flat. They always keep the torso elevated, because doing so reduces what's called venous return, the volume of blood flowing back to the heart, which in turn reduces how hard the heart has to work and how much pressure builds up in the vessels above. Now place both feet flat on the floor. Do not cross your legs. Do not tuck them underneath you. Feet flat, weight evenly distributed, spine supported. By keeping your legs lowered and still, you allow blood to safely settle in the large veins of your legs, which act as a kind of natural reservoir, holding excess blood volume away from your already stressed brain. Gravity, used correctly, becomes your first line of defense. Now, once you're seated correctly, you need to deal with the second deadly enemy working against you in this moment, and it's one that's entirely invisible. It's panic. The second you see a number like 180 on that screen, Your brain shifts into survival mode without asking your permission. Your breathing becomes rapid and shallow. You start pulling air in through your mouth in quick, short gasps. And while it feels like you're trying to calm yourself, what you're actually doing on a biochemical level is making everything dramatically worse. Rapid mouth breathing strips too much carbon dioxide from your blood too quickly. That chemical shift causes your blood vessels to constrict further, squeezing tighter at the worst possible moment. Simultaneously, your nervous system reads the shallow breathing as a signal that danger is present, and it responds by releasing adrenaline and cortisol, stress hormones that stiffen your arteries and force your heart to pump harder. You end up trapped in a vicious cycle where fear creates the very physical conditions that give fear more fuel. Here's how you break that cycle using nothing but the chemistry of your own body. Your sinuses, the hollow chambers inside your nose, produce a molecule called nitric oxide. This molecule is one of the most powerful natural vasodilators known to medicine, meaning it causes your blood vessels to relax and widen, allowing blood to flow more freely with less resistance. When you breathe through your nose, you deliver this molecule directly into your lungs and from there into your bloodstream. When you breathe through your mouth, you bypass this mechanism entirely and lose one of your body's most effective emergency pressure relief tools. So close your mouth. Rest your tongue gently against the roof of your mouth just behind your upper front teeth. Then breathe in slowly through your nose for a count of 4, letting your belly expand rather than your chest. Hold that breath for 7 seconds. Then exhale slowly through your mouth for a full 8 seconds, as if you're gently fogging up a cold window. That long, controlled exhale is the critical piece. It directly stimulates the vagus nerve, the body's own internal braking system, sending a signal down through your chest and into your heart to slow its rhythm and release tension from your arterial walls. Do this cycle 4 times minimum, and you are not just relaxing. You are actively and physically intervening in the chemistry of your own crisis. While you maintain that seated position and continue your breathing, there is a third technique you can apply simultaneously that uses basic physics to physically redirect blood away from your brain. It requires hot water and something to soak your feet in, a basin, a bucket, a large pot, even a kitchen sink if you can reach it without moving much. Fill it with water that's genuinely hot, somewhere between 40 and 45 degrees Celsius, which is about as warm as you can comfortably tolerate without burning yourself. Submerge both feet completely. If there's someone nearby who can help you, ask them to place warm, damp cloths on your hands as well. What you are doing in that moment is triggering immediate vasodilation in the thousands of tiny capillaries and veins that run through your feet and lower legs. Heat causes blood vessels to expand and widen dramatically, and blood, which always follows the path of least resistance, begins flowing downward toward those newly opened channels. You are essentially creating an alternative destination for the excess blood volume that's currently hammering at the walls of your brain's most fragile vessels. Think of your circulatory system like a city's road network during rush hour. Right now, every major route through your brain and heart is gridlocked. What the warm foot bath does is open a brand new highway at the bottom of the map. Traffic doesn't disappear, it redistributes. Blood doesn't vanish, it moves to where the roads are wider and the pressure is lower. Many patients who've applied this technique during a hypertensive crisis describe the headache at the back of their skull simply fading away within 5 to 10 minutes. That's not imagination. That's measurable physics. The pressure at the top of the system decreases because the capacity at the bottom has been expanded. Keep your feet in the water for 10 to 15 minutes, and if it begins to cool, add more hot water. One critical warning though, if you have diabetes or any condition that reduces sensation in your feet, be extremely cautious. You may not feel if the water has become hot enough to burn your skin. In that case, use a thermometer or have someone test the temperature with their elbow the way you would for a baby's bath. The last thing you need in this moment is to swap one crisis for a serious burn injury. There is a fourth element to this protocol that most people never think about during a blood pressure emergency, and it involves a part of your body you've probably never associated with your heart, your neck. The moment you see that alarming number on the monitor, your body tenses involuntarily. The large muscles along the sides and back of your neck, particularly the sternocleidomastoid and the trapezius, contract and harden like cables pulled too tight. And here's why that matters enormously in this specific situation. Your neck is the bridge between your heart and your brain. Running through it are the carotid arteries, which carry oxygenated blood upward to the brain, and the jugular veins, which carry used blood back downward to the heart. When your neck muscles seize up from stress, they physically compress those vessels. Blood is still being pushed up under high pressure by your heart, but the return route, the jugular drainage, gets partially blocked. The result is a pressure cooker effect inside your skull where blood is being forced in but struggling to get back out. To release this, use what's called the downward gliding technique and be very precise about how you do it. Never press on the front of your neck where you can feel your pulse. That area contains baroreceptors, pressure-sensitive nerve endings, and pressing them aggressively can cause fainting or, in worst-case scenarios, dislodge a cholesterol plaque that could then travel to your brain. What you will do instead is place your index and middle fingers just behind your earlobe, finding the small, soft hollow between your jaw and your skull. From that point, apply gentle but firm pressure and glide your fingers downward in a straight line along the side of your neck, all the way to your collarbone. The direction must always be top to bottom. You are encouraging drainage, not stimulating flow upward. The pressure should feel like you're gently stroking the fur of a cat, present, but never forceful. Repeat this 10 times on the right side, then 10 times on the left. This motion stimulates the superficial tissue and fascia beneath the skin, sending a relaxation signal along the vagus nerve and mechanically releasing the compression on your jugular veins. Many people report an almost immediate clearing of pressure behind the ears and a sharpening of vision after just 1 minute of this technique, because intracranial pressure genuinely begins to decrease as the drainage pathway opens back up. You have now addressed 4 of the most critical physical variables in a hypertensive crisis: posture, breathing, thermal circulation, and cervical tension. But there is one final category of mistakes that undoes everything people have just worked to achieve, and it happens through the mouth. When blood pressure is dangerously high, people often feel dizzy, foggy, or exhausted. And out of a desire to feel better or do something, they reach for things they absolutely should not consume in this moment. The first is coffee. The logic seems reasonable, you feel confused and sluggish, so you reach for caffeine to sharpen your mind. But caffeine is a powerful vasoconstrictor. It narrows your blood vessels. Everything you just did with the breathing and the warm foot bath was designed to dilate and relax your arterial walls. A single cup of coffee, tea, or cola at this moment can reverse all of that progress and send your pressure spiking higher within minutes. You would be pressing the accelerator and the brake simultaneously in a car that's already struggling to stay on the road. The second mistake involves salt and sugar. Sometimes the dizziness of a hypertensive crisis gets misread as low blood sugar, and well-meaning bystanders encourage the person to eat something: a cracker, a piece of fruit, a handful of chips. Avoid all of it. Sugar creates an insulin spike that triggers systemic inflammation. Salt, even in small amounts, causes your body to retain fluid. Increasing the total volume of liquid your heart is being asked to push through already strained arteries. Every milligram of sodium you consume in this moment is adding fuel to a fire you are desperately trying to put out. The only thing safe to drink right now is plain water at room temperature, consumed in small, slow sips. Not gulped down in large amounts, because the physical strain of vomiting from an overfull stomach can cause a sudden spike in intracranial pressure that is dangerous at the best of times and potentially fatal in this moment. Now, the third chemical mistake is the most dangerous of all, and it's one that's been reinforced by years of well-intentioned but dangerously incomplete health advice. You've probably heard that if someone is having a cardiac event, you should give them aspirin. That advice is true in specific situations. But applying it blindly during a blood pressure crisis is genuinely life-threatening. There are two completely different types of stroke. An ischemic stroke is caused by a clot blocking an artery. And in that case, aspirin's blood-thinning properties can help limit damage. But a hemorrhagic stroke is caused by an artery rupturing under pressure and bleeding into the brain. When your blood pressure is sitting at 180 over 100, the risk of a hemorrhagic event is extremely elevated. If you take aspirin while a small bleed is already occurring, you prevent the blood from clotting to seal the injury. A contained, survivable bleed becomes an uncontrollable hemorrhage. Without a brain scan to tell you which type of stroke is happening, taking aspirin is not a precaution, it is a gamble with the highest possible stakes. Do not do it. Not unless a physician has confirmed through imaging what is actually happening inside your brain. What you do instead is this. You apply everything in this protocol, you drink small sips of plain water, and you call emergency services if the pressure does not begin to come down, or if you develop slurred speech, one-sided weakness, a sudden severe headache, or vision loss in one eye. Those are the signs that the window for home management has closed and professional intervention is needed immediately. But in the minutes before help arrives, every step in this protocol is buying your body time and reducing the mechanical damage being done to your most vulnerable vessels. You are not a passive victim of a number on a screen. You now understand the physiology of what's happening inside your body, and you have real, evidence-based tools to respond to it intelligently. Posture, to use gravity as a shield. Breathing, to chemically reverse the stress cascade. Warm water, to physically redirect blood volume. Cervical release, to open the drainage pathway. And the discipline to keep harmful substances out of your system during the most critical window. That knowledge applied in those first 5 minutes is the difference between a frightening afternoon and a life-changing tragedy. Your body is remarkably resilient. Give it the right conditions, and it knows how to fight for you.